In 2021, the human rights situation deteriorated further in the United States, where political manipulation led to an increase in death from COVID-19. According to epidemic data released by Johns Hopkins University on November 21, 2021, the number of deaths in the country in 2021 exceeded that of 2020. The United States, despite having the most advanced medical equipment and technology in the world, still has the highest number of new COVID-19 infections and deaths in the world. Since the first case of COVID-19 were recorded in the United States, pandemic prevention and control has always been highly politicized and has become a tool with which Republicans and Democrats criticize and oppose each other. Governments at all levels segregate and limit each other. American politicians, with their eyes fixed on personal political interest, totally ignore the lives and the health of the people. Some Americans, influenced by political manipulation, not only refused to wear a mask, but even started an anti-vaccine movement, which exacerbated the pandemic's spread. According to the U.S. Centers for Disease Control and Prevention (CDC), vaccine boycotts and vaccine hesitancy have caused more than 100,000 preventable deaths nationwide. The COVID-19 outbreak has exposed serious issues such as social inequality and insufficient human rights protections. According to the Washington Post, the COVID-19 death rate for African Americans and Latinos aged 18 to 39 is more than 3 times that of Caucasians, while the Native American mortality rate is almost 9 times higher than that of Caucasians. For American politicians, the survival of the fittest in natural evolution is a great excuse to ignore life itself, and slogans such as "old people can sacrifice themselves for the country" and "the national economy is more important than lives of the elderly" are full of cruelty and neglect. The CDC has determined that most COVID-19 deaths were in those over 65. The strategy of coexistence with the virus has cost hundreds of thousands of lives and will have lingering economic repercussions for the United States, where society continues to fall apart. During the outbreak, homelessness spread across America. On December 1, 2021, researchers at UCLA published a report indicating that nearly 1,500 homeless people had died in Los Angeles County alone during the outbreak. The unscientific, unequal, and irresponsible prevention and control of the epidemics by the U.S. government has seriously undermined the right to life and the health of the American people. The New York Times commented on November 18, 2021, that the United States has failed the major test of COVID-19 in the past 2 years. The American people's trust in government is in disarray. Washington is vigorously pursuing the American First doctrine, not only by withholding anti-epidemic supplies from other countries, but also by banning the export of domestic medical equipment and by monopolizing the supply of COVID-19 drugs. The United States has engaged in vaccine nationalism, pushing some underdeveloped countries and regions into desperate vaccine shortages. NBC reported on September 1, 2021, that since March of the same year, the U.S. discarded at least 15 million COVID-19 vaccine doses in 6 months, and that the number of wasted doses far exceeds the number needed to vaccinate the entire population of many poor countries. The journal Foreign Policy's website stated, "The Biden administration continues to pursue an American interest in a way that harms the interests of the rest of the world." With disregard to the right of life of its own people and the people around the world, the United States has successfully staged ineffective charades of fighting the epidemic and shifting blame. As the world's most developed country, the United States has caused a serious human rights disaster in the prevention and control of the epidemic.